Look closely at your fingernails. Not tomorrow, not sometime later. Look at them right now. Because something as simple as the color, texture, or shape of your nails could be giving you a warning about your kidney health. And the scary part? Many people ignore these signs for years because they think it's just my nails. But sometimes your fingernails are telling a story your body has not been able to say out loud yet. Kidney disease is often called a silent disease because in many cases it develops quietly. There may be no pain, no obvious warning, no dramatic symptom that makes you stop and say something is wrong, but your body can leave clues. And one surprising place those clues may appear is right at the tips of your fingers. Today, we're going to look at 5 fingernail changes that may be connected to kidney disease. And pay close attention to number 4 because it is one of the most commonly missed signs. Many people see it every day and never realize what it could mean. Then, stay until the end because I'll share one rare bonus nail sign that is so closely associated with certain kidney problems that it can immediately raise a doctor's suspicion. Now, before we begin, let me make something very clear. The goal of this video is not to scare you. Seeing one of these nail changes does not automatically mean you have kidney disease. Your nails can change for many different reasons. But understanding these possible warning signs can help you notice changes earlier, ask better questions, and have more informed conversations with your doctor. And that can make a real difference. Kidney disease affects millions of people, and many don't know they have it until it has already progressed. That is why paying attention to small signals from your body matters. So take off any nail polish if you have it on, because we need to see your natural nails clearly. Before we begin, this channel is brand new. I built it to give you information that takes most patients 3 or 4 specialist visits to hear. We are working toward our first 1,000 subscribers, and everyone matters. If what I share today helps you, subscribe right now. 2 seconds, no cost. It helps YouTube show this to more people who need it. Hit subscribe. Let's start with the first warning sign. Number 1, pale or unusually white fingernails. Healthy fingernails usually have a pinkish color. That pink color comes from blood flowing through the tiny blood vessels underneath your nails. It gives doctors clues about your circulation and your red blood cell levels. But if your nails look extremely pale, almost white, that may be a sign that something inside your body needs attention. Here's why. Your kidneys do much more than filter waste from your blood. One of their important jobs is producing a hormone called erythropoietin, often shortened to EPO. This hormone sends a signal to your bone marrow telling it to make red blood cells, and your red blood cells are responsible for carrying oxygen throughout your body. When the kidneys become damaged, especially in advanced kidney disease, they may not produce enough EPO. Less EPO can mean fewer red blood cells, and fewer red blood cells can lead to anemia. This condition is known as anemia of chronic kidney disease. When someone has anemia, one possible visible clue can be pale skin and pale nail beds. Think about it this way. Your nails are like a tiny window showing what is happening underneath. If the blood supply and oxygen levels are not where they should be, your nails may lose that healthy pink color. Now, pale nails do not automatically mean kidney disease. Other conditions can cause this too, including iron deficiency anemia and nutritional problems. But if you notice that your nails have become much paler than usual and you do not know why, it is worth bringing it up with your doctor. There is also a simple test you can do right now. It's called the blanch test. Take your thumb and press down firmly on your thumbnail for about 3 seconds. The nail should become pale because you are temporarily pushing blood away. Now release your thumb. Normally, the pink color should return quickly. If the color comes back very slowly or your nail stays unusually pale, that does not prove you have kidney disease. But it is a reason to pay attention, especially if you also have symptoms like tiredness, weakness, shortness of breath, swelling in your legs, or changes in urination. So look at your nails. Did the color return quickly, or did it take longer than expected? Think about that, because small observations like this can help you notice changes early. Now let's move to the second warning sign. And this one is something many people experience but rarely connect to their kidneys. Number 2, dry, brittle, or cracking nails. Have your nails ever become weak? Maybe they split at the tips. Maybe they peel into thin layers. Maybe they break before they have a chance to grow. Or maybe they just look dull, rough, and uneven. Most people blame things like aging, weather, nail products, or simply bad luck. But sometimes there may be another explanation. Your kidneys help maintain the balance of important minerals in your body. Minerals like calcium, phosphorus, and zinc play important roles in keeping many tissues healthy, including your nails. When kidney function declines, the body may have difficulty maintaining the right balance of these minerals. At the same time, waste products called uremic toxins can build up in the bloodstream because the kidneys are not filtering effectively, and these changes can affect the health and appearance of your nails. This is why some people with kidney disease may develop nails that become dry, weak, and fragile. Now here's where things get interesting. Many people assume every nail problem has the same cause, but the body is more complicated than that. Dry, brittle nails can also happen because of thyroid problems, poor nutrition, vitamin deficiencies, or rapid weight loss. For example, some people taking weight loss medications may lose weight quickly and unintentionally reduce their intake of important nutrients. That nutritional change alone can affect nail strength. So don't look at brittle nails and immediately assume kidney disease. Instead, ask yourself, is there a clear reason this is happening? Has this change appeared suddenly? Do I have other symptoms that concern me? If the answer raises questions, talk with your healthcare provider. A simple blood test, such as a basic metabolic panel, can provide important information about kidney function. And here's something I hear often from patients. They tell me, I noticed my nails were changing months ago, but I never thought it meant anything. Sometimes the smallest changes are the ones we ignore the most. Before we move to the next warning sign, let me ask you something. If someone told you that your fingernails could reveal clues about your kidney health, would you believe them? Or would you think, there's no way my nails can tell me something about my kidneys? Let me know your thoughts, because the next signs we're going to discuss are even less known. And number 4 is the one that surprises many people the most. Number 3, Terry's nails. This is one of the nail changes that many people have never heard of. In fact, many people, and even some healthcare professionals outside of kidney specialists, may not immediately recognize it. Terry's nails have a very specific appearance. Most of the nail becomes pale or almost white. Then, at the very tip of the nail, there is a narrow horizontal band that appears reddish, pink, or brown. So imagine looking at your fingernail and seeing that most of it has lost its normal pink color, but the very end still has a darker strip. That pattern is what doctors call Terry's nails. They were named after Dr. Roberto, who described this nail change in the 1950s. Now, why can this happen with kidney disease? One reason is that advanced kidney problems can affect the body's protein balance, especially a protein called albumin. Albumin helps maintain fluid balance and supports healthy circulation. When kidney disease causes significant protein loss, particularly through the urine, albumin levels in the blood can drop. At the same time, poor circulation and changes in blood flow can affect the appearance of the nail bed. The result can be that pale, almost white appearance across most of the nail. Studies have found Terry's nails in a significant number of people with serious kidney disease, especially those with kidney failure. But here's something important. Terry's nails are not only connected to kidney disease. They can also appear with other conditions, including liver disease, heart failure, and some other chronic illnesses. So if you notice this pattern on your nails, do not panic. Instead, think of it as a clue that deserves a conversation with your doctor. Your doctor may want to check things like kidney function, blood protein levels, and other markers to understand what is happening inside your body. And here's a question worth asking yourself. Have you ever looked closely at your nails before? Most people only notice their nails when they need a manicure or when something breaks. But your nails are constantly growing, constantly changing, and sometimes those changes can tell you something important. Now, we're moving to the warning sign I told you about earlier. This is the one that surprises many people, and it is one that kidney specialists pay close attention to. Number 4, half and half nails, also called Lindsay nails. The name almost explains the appearance. Half of the nail looks one color, the other half looks different. Usually, the lower part of the nail near the cuticle appears pale or white. Then, about halfway up, the upper part of the nail becomes darker, often appearing reddish, brown, or tan. The separation between the two colors can look very clear, almost like someone drew a line across the nail. Now, here's why this sign is so interesting. Half and half nails are strongly associated with chronic kidney disease. They are often seen in people with reduced kidney function, especially those with more advanced disease. But many people never recognize them. They may look at their nails and simply think, my nails look a little different. They may not realize that this unusual color pattern could be connected to their kidneys. So what causes this appearance? When the kidneys are not working properly, waste products can build up in the blood. These are often called uremic toxins. At the same time, kidney disease can affect mineral balance, circulation, and changes in the tissues under the nails. All of these factors can contribute to the unique appearance of half and half nails. When a kidney specialist sees this pattern, it can immediately raise questions about kidney function. Doctors may look more closely at tests such as creatinine levels, estimated glomerular filtration rate, also called eGFR, and other kidney-related blood and urine tests. But remember something important. No nail sign can diagnose kidney disease by itself. Your nails can provide clues. They cannot replace medical testing. If you notice this half and half appearance, the right step is not fear. The right step is information. Take a clear picture. Show it to your healthcare provider. Ask whether your kidney function has been checked recently, because sometimes the body whispers before it starts shouting, and your nails may be one of those quiet signals. Now let's talk about the fifth warning sign. This one is different because it is not about color. It is about a change in the structure of the nail itself. Number 5, Bow's lines. Look closely at your fingernails. Do you see horizontal grooves or dents running from one side of the nail to the other? Not the vertical lines that many people naturally develop as they age. These are different. Bow's lines are horizontal marks that appear when nail growth temporarily slows down or stops. To understand why this happens, you need to know how your nails grow. Your fingernail is produced from an area at the base called the nail matrix. Think of it like a nail factory. Most of the time, this factory works continuously, creating new nail tissue. But when your body experiences major stress, that factory can slow down. This can happen during serious illness, severe infections, major nutritional problems, or significant changes inside the body. Kidney problems can sometimes create this kind of stress. For example, an episode of acute kidney injury, severe electrolyte imbalance, or a serious hospitalization can interrupt normal nail growth. When the nail starts growing again, that interruption leaves behind a visible horizontal mark. That mark becomes a timestamp. It is almost like your fingernail is recording a difficult period your body went through. Some people may notice one line, others may have multiple Bow's lines. Multiple lines may suggest multiple periods where the body experienced significant stress. But again, this does not mean every Bow's line equals kidney disease. Many other conditions can cause them. The important question is, what happened around the time this line appeared? Did you have a major illness, a hospitalization, a serious infection, a sudden health change? Your fingernail may not tell you exactly what happened, but it may remind you that something important did. And that is why these changes deserve attention. Now, those are the 5 major fingernail warning signs we talked about, but if you stayed with me until this point, I promised you one more. A rare sign, a sign that most people have never heard of. And when doctors see it, it can provide a very strong clue about a specific kidney problem. Let's talk about that next. Bonus warning sign, Muirche's lines. This is one of the rarest nail signs connected to kidney disease. And because it is so uncommon, many people have never heard of it. Muirche's lines look like 2 pale horizontal bands that appear across the fingernail. Between those 2 pale lines, there is usually a normal-looking pink area. At first glance, they can look similar to Bow's lines. But there is one very important difference. Bow's lines are actual changes in the nail itself. They grow out as your nail grows. Muirche's lines are different. They are not inside the nail plate. They appear because of changes in the tissue underneath the nail. That means as your nail grows, Muirche's lines usually stay in the same position instead of moving toward the tip. So why can this happen? One of the main reasons is a significant decrease in albumin, an important protein found in your blood. Albumin helps keep fluid balanced inside your blood vessels and plays an important role in maintaining healthy circulation. In certain kidney conditions, especially conditions where the kidneys leak large amounts of protein into the urine, albumin levels can become very low. One example is nephrotic syndrome. When too much albumin is lost through the kidneys, the level remaining in the bloodstream can drop. That change can affect the small blood vessels underneath your nails and create those distinctive pale bands. Now, I want to emphasize something. Muirche's lines are rare. Most people with kidney disease will never develop them. But when doctors do see this specific pattern, it can be a very important clue. A physician may want to check tests such as your blood albumin level, a urine test to look for protein loss, and a urine albumin to creatinine ratio, often called a UACR. These tests help doctors understand whether the kidneys are allowing too much protein to leak into the urine. So take another look at your fingernails. Do you notice any unusual lines, color changes, or patterns that you have never paid attention to before? Remember, the purpose is not to diagnose yourself from your nails. Your nails are simply a messenger. They may be giving you a reason to ask better questions, and that is exactly what this information is about. Awareness, not fear. Now, if you stayed until the end, you know something that many people do not know. Your fingernails are not just something you trim or paint. They are living tissue connected to what is happening inside your body. Changes in your nails can sometimes provide clues about your circulation, nutrition, hormones, and even kidney health. But here is the most important point. A nail change alone does not mean you have kidney disease. Many nail changes have harmless explanations. The key is looking at the bigger picture. Are you also experiencing unusual fatigue, swelling in your feet or ankles, changes in how often you urinate, foamy urine, unexplained bruising, high blood pressure? These symptoms, combined with nail changes, are much more meaningful. And if you are at higher risk for kidney disease, it becomes even more important to stay aware. Risk factors include diabetes, high blood pressure, a family history of kidney disease, heart disease, or being older than 60. If any of those apply to you, regular kidney screening can be one of the smartest things you do for your long-term health. A simple blood test can check kidney function. A urine test can look for early signs of kidney damage. And sometimes, catching kidney problems early can make a major difference. So the next time you look at your hands, don't just see your fingernails. See them as small signals from your body. Signals that may help you notice changes sooner. Because when it comes to your health, early awareness gives you more choices. If you found this information helpful, share it with someone you care about. You never know, a simple conversation about fingernails could encourage someone to finally check something they have been ignoring. And if you want more science-based health information explained in a simple way, make sure you subscribe. Your body is always communicating with you. The question is, are you paying attention?